Hello, and welcome to the Role of Work in Recovery. This is the first session in a four-part series that trains practitioners on how to integrate employment and education services in various mental health modalities of service. This webinar series is sponsored by Oaks Integrated and the Integrated Employment Institute of Rutgers University within the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Amy Banco, and I'm a faculty member within the Integrated Employment Institute. The Integrated Employment Institute has more than 20 years of providing career services and training in a variety of mental health settings, including but not limited to housing and CSS, PAC teams, supported employment programs, as well as supported education programs. We offer training in career development for adults, young adults, and transition age youth with mental health conditions. The Integrated Employment Institute is passionate about training New Jersey's mental health providers on how to infuse the evidence-based practice of supported employment and supported education into service provision to enhance clinical as well as personal recovery outcomes. This first webinar will serve as a foundation for the next series of webinars. The objectives within today's session include reviewing recovery and defining recovery-oriented mental health services, identifying key benefits of employment and education, as well as looking at common barriers and strategies to supporting individuals in obtaining employment. Throughout this session, we will be asking for you to consider the application of content and reflecting on some of the information provided to you. It is recommended that you get settled in with a piece of paper and pen, or open up a Word doc so that you can jot down responses to questions, potential questions that you may have from today's session, as well as ways you would like to utilize today's information in your service provision at Oaks Integrated. Before we talk about the relationship of work and recovery, let's first define the term recovery. What does recovery mean to you? Recovery is a word that we use frequently within our conversations with collaborative providers, in our supervisory sessions, as well as our service provision with individuals with mental health conditions. It's important that when we're using terms and verbiage, we have a shared definition within our organization. So consider for a moment, how do you define recovery? Feel free to pause the video and jot some of your thoughts down. Within our session, we are going to be talking about recovery, and we're going to be making distinctions between the terms clinical recovery and personal recovery. Historically, the mental health service system worked under the medical model of care, which influenced service provision. Before someone could consider returning to work, the system messages were to wait until the person was symptom-free, clean and sober, had stable housing, or had any other potential issues related to work, such as anger management, hygiene, time management issues, etc., resolved. Imagine if you were told to hold off on your goals of employment or even education and going back to school until you were able to fix all of the potential issues you could be experiencing. When would those goals begin? Most people reflect on this and say never, right? This was historically the underlying belief. Again, that belief was that everyone had to achieve clinical recovery being things measured such as improved symptoms, reduced hospital stays or no hospital stays, reduction in the usage of clinical services, compliance to medication, or reduction in medication. However, this false dichotomy, right, of believing one or the other is operating under false pretenses. Because what if the things that we are looking to help support people reduce in terms of clinical recovery are not solely attributed to mental health conditions? So that is why within the psych rehab modality, we focus on personal recovery. Personal recovery can be defined as reclaiming one's life after a diagnosis of a mental health condition, having new expectations for one's life, learning to live with their health condition, and achieving and working toward a valued social role. So make sure as you move throughout the series, you're identifying how employment and education services can build upon not only personal recovery, it can intertwine that clinical recovery as well. In looking at recovery themes, we look here and see that qualitative studies identify there are common themes to this notion of recovery from various recovery advocates. Two of these themes that we find in the literature that are applicable to our discussion on the role of work and recovery is recovery being a fluid process, and that providers and systems can help promote choice and independence that recovery is contingent upon. As you can see, recovery is something that is not a destination. It's a series of steps that may not be solely linear. It's a process. And we always start where the person is at and assist them in identifying the objectives to move forward. Additionally, when we look at this other theme, promoting choice and independence, it's core that the service system that Oaks integrated, that providers within Oaks integrated emphasize work and school contribute to one's recovery, promoting choice and independence. Looking at how work and school can provide hope and optimism that individuals can expand choices in their lives and begin to envision a life as a worker or student. One of my favorite quotes is from Bill Anthony, Boston University professor, who noted that recovery is deeply personal, a unique process of changing one's attitudes, values, feelings, goals, skills, and roles. It's a way of living a satisfying, hopeful life, even with potential limitations caused by a mental health condition. Recovery involves the development of new meaning and purpose in one's life as one grows beyond the catastrophic effects that can occur with a mental health condition. Additionally, we see from the executive director of NAMI, work is a critical part of recovery. As a nation, and I dare say as service system, we have a long way to go in recognizing that linkage. And lastly, we have a mention from Pat Deegan, who is a world-renowned mental health disability rights advocate, a psychologist, a researcher, and fierce peer leader. And she notes people need something to organize their recovery around. For many people, that something is work. There is a link to Dr. Deegan's presentation below from the 2012 Summer Institute for Informed Patient Choice at Dartmouth. We would like for you to take this opportunity to click on that link and watch this 3-minute video. As you review that video, grab your sheet of paper or pull up your Word doc and consider what impacted you the most from this clip. What emotion or feeling does Dr. Deegan generate in you as you listen to her speak? And how is Dr. Deegan's message relevant to the work that you do, to the people that you provide service to? As you consider and reflect upon Dr. Deegan's comments about employment and the profound positive impact, the pervasive impact that employment can have, we need to start considering what the absence of employment looks like. So when we consider unemployment, right, the absence of unemployment, there are profound side effects that individuals experience. And the studies that you're seeing here, the data that we're pulling from, are studies that were done with individuals that did not have a DSM diagnosis. A lot of these studies occurred during the Great Recession, right? That period from 2008 to 2012, where there was a significant dip in the labor market, where the United States rate of unemployment skyrocketed. We are now experiencing a similar issue in 2020 and 2021 due to the COVID-19 pandemic. And we are seeing again these vast and profound and insidious side effects of unemployment, right? So we see on the left side of our screen what gets increased when someone is unemployed, and when they're unemployed without a DSM diagnosis, when they do not have a mental health condition, we see increased anxiety, increased social isolation, increase in housing instability, in cardiovascular disease, increase in suicidal ideation, symptoms of depression, and substance usage. And on the flip side, decreases in self-identity, socialization, coping skills, general health, financial stability, as well as sleep. Do these things look familiar? If I were to take out the title, Side Effects of Unemployment, and replace it with the symptoms and side effects of mental health conditions, it would look very fitting, I'm sure, because we see this time and time again in the people that we're providing services to within the public mental health service system sector. And so there's this vast area of literature, not just within the human services research, but we see this in economic research, labor market research, as well as research on the social determinants of health, right? The absence of employment has profound effects on our mental and physical health and can create these particular issues. And for me, this was an aha moment, because there's so much overlap between the impact of a mental health condition and the side effects of unemployment. It's impossible to parse out what is causative of what, or what is exacerbating what. So, making the point, we will never be able to sit and determine if someone's experiencing increased anxiety and depression due to their diagnosis of a mental health condition or the fact that they're unemployed and experiencing side effects of that unemployment. And because of this overlap, and because we cannot parse out what is causative of what, if we fail then to provide career services, employment services, education services, until all of those side effects are relieved, right? We will prohibit or preclude individuals within service from achieving recovery, right? If those side effects that we're seeing are because of unemployment and we're holding off on employment services, we cannot provide enough mental health services to reduce the side effects of unemployment. Only employment can reduce the side effects of unemployment. So we have to take a good look at how the system is set up currently in terms of supported employment services, vocational services being separate and distinct, right? Needing referrals out to supported employment services could be detrimental to how people can achieve and attain not only personal recovery, but those clinical recovery measures. So in looking at this, these side effects that people may experience from unemployment, the question comes up then, right? For people that we are providing services to, or even for yourself, why do we work? Why do you work? If unemployment has all of these deleterious side effects, what are the benefits of employment? Go ahead and list your benefits. We can see that there are many, many reasons why individuals obtain employment. I'm sure on your sheet you listed things like obtaining a salary or getting health care benefits. You might have listed for socialization purposes, meeting people. You may also have listed how work impacts your self-esteem or identity. And those are all accurate, not just anecdotally, but what we see in literature. Let's take that research further and explore what the benefits are specifically for people with mental health conditions. So people with mental health conditions are going to obtain all of the benefits from work that you may have listed on your sheet, that I may have just reviewed. But we also can see, specific to the population of people with mental health conditions, when they obtain work, they have decreases in symptoms, number of hospitalizations, length of hospitalization, substance use, and earlier mortality rates, right? This all decreases when people obtain employment who have mental health conditions. We see obtaining work increases self-esteem, builds community integration, improves general functioning, assists with housing stability, and increases quality of life. Right, so this is a flip side of everything that we saw in terms of the impact of unemployment. And so this is psych rehab in action, people executing their preferences through their recovery roles, obtaining meaningful normative developmental roles within a person's preferred environment, compatible with their values and interests that lead to these, again, clinical recovery outcomes. And so if we know, if we can reflect on this literature and say work is so good for people with mental health conditions in terms of the benefits, we would think in terms of employment rate for people with mental health conditions in the public mental health service sector that it would be high, right? If work leads to these amazing clinical outcomes as well as recovery outcomes, employment rates should be high. Take a minute and guess what you think the employment rate is for individuals with mental health conditions within the public mental health service sector, for individuals that have historically been identified as having severe mental health conditions. And we see that that number, that percentage of individuals employed is very low. We know work is so good for people in general, and especially for people with mental health conditions. The benefits are diverse and documented in numerous studies. And yet here we are, below 20% with in 2012. My apologies, this research was conducted in 2014 by NAMI, and they have not provided an updated graph. We use this graph because the visual is so impactful and the rates are still quite similar. In fact, I would wager that due to the 2020 pandemic, since employment rates are down significantly for the general population, one would assume that those rates have also dipped as well for individuals with mental health conditions. And so this is a huge issue. people with mental health conditions are seemingly precluded from the workforce, precluded, therefore, from the benefits of employment, and are oftentimes experiencing the side effects that we reviewed of unemployment. And sadly, when we look at that literature, most adults with mental health conditions want to work. And we know that the majority can succeed with the right supports. Sadly, again, not even 2% of people within the public mental health service system are receiving supported employment services. These segregated services are not enough. And we'll talk about that in a second. So what do we think is the contributing factors to this discrepancy? It's multifactored, one of which is the barriers to employment, right? People with mental health conditions in the public service sector may not access employment because there are significant barriers. Take a moment and write down what you think some of those barriers to employment look like. These barriers can include things like the mental health condition itself, so symptoms and the functional implication of symptoms, medication side effects, the impact of the psychiatric illness on one's psychosocial wellness, the fragmented mental health service system, concerns about public benefits, state or federal benefits, such as Social Security, stigma, and that's in all caps because that is very big in terms of concerns that providers have, concerns that people in service have, and prejudicial or discriminatory beliefs that employers may have, as well as lack of vocational maturity. This list is obviously not exhaustive, but one of the common barriers that are listed that we see in research. As we progress in our training series, we'll be training you further on how to address these barriers to employment with the individuals you're working with. Another concern, again, for individuals with mental health conditions in accessing employment and getting support with employment is that right now, employment services are not infused, education services are not infused in all program modalities. There is a notion or mentality that I don't do employment, from direct service staff to managers to administrators. And so we ultimately need to redefine treatment and mental health service modalities to incorporate vocational services, specifically career development services, into all service modalities. Essentially infusing supported employment and supported education into practices. And we can start by doing things including the following: early and ongoing discussions about employment and education interests or goals, slowly building and integrating our vocational services into our clinical services, looking at career goals as equivalent to clinical goals and a means to achieve personal recovery as well as clinical recovery, promoting wellness strategies to support work and school, as well as identifying community-based and natural supports. Take a moment and think about what you can do in your services. Furthermore, you can think about and speak with your team as you consider what has been an employment or education resource you've found valuable that you can start incorporating into your services. Thank you so much for joining today's session. We look forward to engaging with you in this training initiative.